What are some of the benefits of fasting for the heart health is the question I will be answering on Ask Nutritionist Deepa's podcast episode. So, as you know, February is a heart health month, and I have been talking about heart health throughout the month in each of my podcast episodes and our newsletter. And this question came to me because from a client of mine, and she is fasting for the religious reason right now. The Lent is people are fasting for Lent, and she is fasting for that reason. But she has some heart condition and high cholesterol, so she wanted to know if fasting is safe for if she has high cholesterol. Well, first of all, fasting, either for religious or and spiritual reasons, has been part of our human culture for long periods of time. Okay, and along with uh, just being fasting for the religious reason, the it's been considered as the oldest therapy in medicine to cure and prevent diseases. So fasting is not only has a religious and religious importance, but also a medicinal properties. Many the it is a well known fact now that the fasting allows our body to heal itself. Okay, it's part of the healing, it's part of renewing, it's part of recycling. So fasting definitely has lot of benefits, and it's very interesting. Every culture, every religion promotes fasting. Islam, Muslim religion people do Ramadan. Indians do a lot of fasting either every month, or there is an extended period in certain months where fasting is recommended. Of course, in among Catholics, Lent is the time when fasting is recommended. So that's so as we the every culture, every religion, to me it's very scientifically it's rooted in science, and I think that science is exhibited through this practice of fasting. So what does fasting does? First of all, the it's very important to understand that fasting does not mean starving yourself. Okay, the benefits of fasting are are maximum when you feed yourself with right kind of food during the feasting period. Most of the time people who fast for religious reason, they come out of fast as if they have been depriving themselves or starving themselves, and the feast is full of lot of just high caloric, low nutrient dense food items. So it's very important to first of all understand that when you are fasting, make sure that when you are off of your fasting window, you are eating nutrient dense foods and not just calorically dense foods. That's just the underlying principle. But let's first talk about how fasting is going to affect heart health. First of all, fasting helps us clean out old junky proteins and cellular parts. Okay, at the same time, it not only allows us to survive but also thrive. Our human body thrives really well when there is a shortage of especially calories. It optimizes itself to become efficient in reusing what it has. The one of the benefit of fasting is it decreases the insulin levels in our excessive insulin levels in our body, which means that it's going to help us reduce inflammation, because excessive insulin is connected or results in is inflammation. So by reducing the insulin in the bloodstream, it helps reduce inflammation. Secondly, fasting helps improve the insulin resistance, which means that many times the insulin levels in the bloodstream are high because there is insulin resistance due to your cells being full with fat and are resisting the insulin to do their job. Okay, so that response goes down when we fast, because the fasting helps improve the insulin sensitivity. So there are two things happening as far as insulin is concerned. One is it reduces the level of insulin, which is good. And secondly, it improves the insulin resistance. So whatever insulin we have, it it is utilized efficiently. Number two, it stimulates growth hormone. Growth hormone helps to preserve muscle mass and bone density. Now remember, heart is a muscle. Okay, so as we age, we lose our muscle mass, we lose our strength. So fasting is going to help us maintain the muscle mass. So if you have a weaker heart, actually, or weaker heart muscle, fasting is going to help you strengthen that. Uh, Number three, it breaks down cholesterol, uh, especially unwanted cholesterol or excessive cholesterol, because when we are fasting, we are creating a caloric deficit. We are not constantly feeding our body with fat and calories and uh, macronutrients, and hence body tries to break down the excessive storage units, and that's how it helps with the cholesterol, because it's going to utilize cholesterol molecule for energy, because there is a deficit. um, that's a definitely an added incentive to do fasting for heart health, because as I was saying, it helps breaking down of cholesterol. It helps gut lining. You know I'm all about gut health. So fasting helps gut lining, which means that it's going to help improve the absorption of nutrients. It's going to help the breakdown of nutrients. And when that happens, it improves the blood flow. So our heart is a part of cardiovascular system, which means it involves a lot of veins and arteries and nerves, so on and so forth. So when our gut health is where it needs, where it is, where it should be, and when the gut lining is healed and all the nutrients are getting absorbed properly, then your blood flow to different organs is going to improve, and thus your heart is going to get adequate amount of blood to circulate. So gut fasting helps heal the gut lining. So moving on, it the most exciting part about fasting is it stimulates the stem cells. Okay, now what are the stem cells? So stem cells provide new cells for the body as it grows and replaces specialized cells that are damaged or lost. Okay, so for, let's say you have had a heart surgery, or there is an injury, or usually we see with the joints, so what fasting does is it stimulates the production of stem cells. So if there is a damaged part, it gets replaced. Now that is a extremely beneficial uh, effect of fasting, I think. Without surgery, without any major intervention, you are stimulating your body to create stem cells to replace the damaged parts. I mean, what more we want? So, again, in nutshell, fasting helps by stimulating the growth hormones, which tells our body to start producing some new body parts or cells for the body, so we get new parts. And at the same time, it also stimulates the stem cell production to replace the old parts with these new parts. So all in all, fasting, either for religious reason or in recent years, a lot of people do it for do the intermittent fasting as a lifestyle choice. Either way, it's a wonderful thing to do. Now, couple things before you start fasting. There are different ways of or different fasting windows. There's 12 hours, 14 hours, 16 hours, 24 hours, 48 hours. If you have diabetes or severe heart condition, I wouldn't recommend jumping into more than 16, 24, or 48 hours. It's always a good idea to start with 12-hour fast, which is easy to do, and then slowly adding extra half an hour and another 45 minutes and extra hour, and then stretching it to 14 hours, 13 hours, 14 hours, and then maybe just doing it for 16 hours, maybe once a week or once every 2 weeks. Secondly, as I was mentioning, fasting should not be used to control your food intake. Okay, so if you have eating disorder, uh, then fasting is not a good idea. Fasting is not about artificially restricting or avoiding the food for the sake of starving your body. That's not the whole. That's not the purpose of fasting. Fasting is done very mindfully. It's done very systematically, and it's a lifestyle choice. And there are no starvation has a lot of side effects, like starvation leads to cravings and malnutrition. Fasting doesn't do any of that, because fasting focuses on cutting down the amount cutting down your eating window and making sure that you are eating adequate amount of nutrient dense foods. However, many times what happens is, because our eating window has gone down, we tend to eat foods which are obviously high in macronutrients, like carbohydrate, fat, and protein, and and we tend to start become deficient in micronutrients, like different kinds of vitamins and minerals. And uh, therefore, it's extremely important that if you are fasting, and especially if you have any kind of health condition, that you are getting a good supplemental of micronutrients, like a good multivitamin, for example. You are make sure you are getting adequate amount of water and electrolytes. Okay, so it's important that you meet your micronutrient demands for the day by eating enough fruits and vegetables, and which are nutrient dense, rich in antioxidants, and taking a good multivitamin, and your macronutrient by making sure you are eating slow glycemic index carbohydrates, plant-based protein, and your fats are coming from nuts, seeds, mm, and avocado, so on and so forth. Make sure you're drinking enough water. You can sip on electrolyte, such as coconut water would be a good example of electrolyte. I'm not talking about drinking Gatorade. So fasting, either for religious reasons, spiritual reason, or as a lifestyle, is an extremely beneficial lifestyle choice to make. And it has tons of health benefits, specifically for heart, as I outlined in the episode today. If you have any other questions about fasting, feel free to send me an email and I will address them here. Until then, Happy Lent, happy fasting. Be make mindful choices. Take care of yourself. Self care. Take care of your heart, and spend some time contemplating, being mindful. And I will see you next week with another set of question and answers. Thank you again for watching, and keep those questions coming, and I will talk to you soon.
Hi, I'm nutritionist Deepa. Over the years, I have seen my patient suffer from low energy, pain, and cravings. In order to help them, I have created a comprehensive 26 nutrient formula. Nutrients such as iron and folate is going to help with energy. Zinc and rhodiola is to reduce pain, and B complex, vitamin C, and magnesium helps reduce cravings. For more information, click on the link below.